A 14-year-old girl is brought to the emergency department due to progressive weakness in the lower limbs for 3 weeks. Her parents first noticed clumsiness, which has progressed to difficulty walking over the last week. The patient had a fever, cough, and congestion about 1 month ago and has otherwise been well. She has a history of high plantar arches requiring orthotics and mild scoliosis. The patient takes no medication and has no allergies. Her parents and 2 older siblings are healthy. On examination, she has a wide-based gait and has difficulty maintaining balance without assistance. Vital signs are normal. Strength is 2/5 in the lower extremities and 5/5 in the upper extremities. There is decreased vibratory and position sense in the lower extremities. MRI shows cervical spinal cord atrophy. What is your differential diagnosis? Friedreich Ataxia FA. The most common hereditary form of ataxia is an autosomal recessive condition that classically presents with progressive ataxia in adolescence. Friedreich ataxia is caused by an excessive number of trinucleotide repeat sequences, most commonly GAA in the frataxin gene. Neurologic findings include dysarthria, limb weakness, loss of deep tendon reflexes, and progressive gait and limb ataxia. Loss of position and vibratory senses occurs due to deterioration of the dorsal spinal column. Skeletal comorbidities include kyphoscoliosis and pes cavis high-arched feet, as seen in this patient. Hypertrophic cardiomyopathy occurs in most patients, with an increased risk of arrhythmia and heart failure, usually leading to death by age 40. Imaging may reveal cervical spinal cord atrophy. Diagnosis is confirmed by genetic testing. Management is supportive, for example, physical therapy, psychological support, as no disease-modifying therapies are available. Prenatal genetic testing and counseling are available for future pregnancies for confirmed cases in siblings or if both parents are known carriers. Ataxia telangiectasia is also an autosomal recessive, progressive disorder that presents with ataxia in addition to ocular and cutaneous telangiectasias. Patients have DNA repair deficits that increase the risk of malignancy. Viral encephalitis can present with ataxia, but patients have fever, seizure, or altered mental status. Imaging reveals brain edema and inflammation. Acute cerebellar ataxia is typically a post-infectious disorder that presents with acute onset of ataxia, nystagmus, and dysarthria. Guillain-Barré syndrome is an immunologic polyneuropathy that classically presents with acute ascending weakness and areflexia. However, neither condition affects vibratory and position senses, and both usually resolve with supportive care, in contrast with Friedreich ataxia.